before we start, I would very much like to thank the Sir James Dunn Animal Welfare Center for sponsoring this webinar series. These have become extremely popular, and they're a chance to take hot topics and share some information and thoughts to an extremely diverse audience. And that's part of the outreach, so that behavioral medicine and welfare reach everybody that matters, which, you know, includes pet owners and people who help care for animals and veterinarians and researchers. So today we're going to talk about attachment, and these are my two youngest dogs. Obviously, Annie is a puppy and Hamilton is 2. And I guess I would say they're quite attached to each other, even though there are almost no research papers on attachment between dogs, which is interesting. So we're going to talk about attachment in cats and dogs and what can the data tell us. And being data-driven, I'm actually going to share other people's data with you. Now, because this is being recorded and you'll have access to it, you'll be able to have what I wrote on these slides, which is a means of discussing what people have found. And I'm going to refer to the original literature. So there's a lot more information on these slides in the terms of setting up the argument and the story that I'm going to read to you. That's sort of as a reference for later. But the other thing is, I wanted to use the author's own words so that you can see how fraught this issue is with people struggling to figure out how to think about this. I want you to see the thought process of the people involved, because it's really how science works. And I think too often we do derivative things, and the voice of the authors who are really struggling with some of this stuff is lost, and I don't want it to be lost. So I'm going to tell you the story of how people have thought of attachment. And I think the first thing we have to ask ourselves is, what is attachment? And I tend to always start everything with a definition, because it really helps if we all are speaking the same language, or at least understand what the other person means, even if we disagree with it. And in this paper on owner attachment and problem behaviors related to relinquishment, Quan and Bain define attachment as a multi-dimensional combination of the amount of time and the type of activities you do with the pet, the interest in the pet and your emotional closeness to the pet, the knowledge of the pet and their required care, and the owner's behavioral responses to their pet. So you have these number of factors on 4 axes that basically define where you fit in their attachment space, okay? And that's just their definition for this paper. And I need to tell you, every single one of the papers that I will reference, except for one, is freely available on Google Scholar if you wish to download them for yourselves. Okay, Prada-Perviti actually, years and years before this is a 1993 paper, proposed the use of a slightly modified Ainsworth-Strange situation test to see if you could tell whether the owner-dog bond was an affectional bond or a true attachment. In other words, did they like each other, or were they truly in this type of relationship? Now, this test has been around since the 70s for young children. And let me tell you what it is first, because it is a test that tests the attachment of children to their mothers. And the child is observed for playing for 21 minutes while the caregivers and strangers enter and leave the room, recreating the flow of familiar and unfamiliar people going in and out, which happens in kids' lives. The situation varies in stressfulness, and the child's responses are observed. And they're done in this order because they want to start out in a sort of calm place and then add changes. So this is what the test looks like. The parent and infant, it doesn't have to be a mom, but it usually is, are introduced to the room. They're alone. The parent lets the kid explore. The stranger enters, talks to the parent, approaches the infant. The parent leaves, and they leave in a way that they make sure that the child notices. The first separation episode, the stranger's behavior is geared to that of the infant. In other words, whatever that child does, the human responds to that in a context-dependent manner. First reunion episode, parent greets and comforts the infant and then leaves again. The infant's again alone. You get a continuation of this where the stranger enters and gears their behavior again to the infant. You get a second reunion episode, parent greets the infant, picks it up, and the stranger leaves, ending that. And this would be very similar, you know, if you had someone who was staying with you, who helped caring for the child. So this is the model that has been used for dogs and cats. We can argue about whether it's an appropriate model. Okay. The aspects of the child's behavior observed include the amount of exploration. Do they play with new toys? How do they react when their human leaves? What happens when they're alone with the stranger? And what happens when their person comes back? And Ainsworth then defined her attachment styles as secure, anxious, avoidant, and insecure. In other words, you avoid interaction with the parent when it comes back, and you avoid interaction with the stranger. Anxious, ambivalent, / resistant, which is another insecure attachment style, where you're not really sure what you want to do, but you seek comfort. And a combination of styles that was called disorganized or disoriented. And it's another insecure attachment style. And it's sort of where they put the outliers in this group. It's not that common in humans, and you'll see it's not that common in cats and dogs. So Prada-Purviti in our 2003 paper, I think I called it a 1993 paper. The affectional bond is one that endures over time. It involves a specific individual. It's an emotionally significant bond. And the individuals prefer to have contact with each other, and they'll become distressed when involuntary separation occurs. Attachment is a specific type of this bond, where everything I said is true, but you add a secure base effect. And a secure base effect is when an individual obtains security and comfort from the other. And then you can separate yourselves and engage in other activities without that individual being present. And I need you to remember that later, because when we talk about cats at the very end of it, there's a different definition used. So remember, in this case, it's a specific type of affectional bond where the individual gets comfort and security and then can separate themselves they're confident enough to leave and engage with others. And the authors propose that a dog with a more secure base would be more inclined to explore an unknown room and play with a stranger more if the owner was present. Now, the question we have to ask, and this goes back to the structure of the Ainsworth strange situation test, is that valid? Because in reality, the dogs are at different developmental stages and they do very different things than the children do. And we interact differently with the dogs. And certainly in the cat and most of the dog tests, no one is mirroring the dog's behavior and responding to it in context. So there are differences here, and I think we have to acknowledge that. The authors determined that the human-dog bond is a strong affectional bond, but they failed to identify a secure base. And when considering this conclusion, one should remember that the study utilized a design that's for human infants, a different definition of attachment that had been used for dogs in the past, and a secure base issue is in human psychology, and it has had its roots in the early maternal nurturing literature in psychology. And in a few minutes, we're going to talk about Bowlby's work, just in passing. And this is where the issue of attachment came up when monkeys and babies are early separated and then they don't have access. So I want to remind you that the child's behaviors are mirrored by the response of the stranger. And this secure base is almost a quality of being disrupted in a deeper sense than may be relevant for dogs and cats. And it's something to think about. So this is a paper by Vali Parthasarathy and Sharon Crowell Davis at the University of Georgia. It's a 2006 paper. And they decided to look at attachment to owners and separation anxiety in pet dogs. And they did so because at that point, people were beginning to say, and I'm going to show you the first paper where the word hyperattachment occurred in the 90s, people were beginning to say, well, you know, this attachment issue affects separation anxiety. Dogs with separation anxiety are hyper-attached to their humans. And that's why they get distressed when they leave, because they don't have a secure base, et cetera, et cetera. So they decided to take on the issue of attachment, separation anxiety, and hyperattachment, and they review the Bowlby literature. And you'll remember the rhesus monkey stories from 1958, where the monkey is holding on to a towel-wrapped piece of wire. And Bowlby was very interested in what happened when, in the process of learning to let go, or absences, or insufficient nurturing and nutrition, actually. So these are direct quotes from the paper, and Bowlby stated that attachment can be seen in the reactions of one individual when separated from another. That goes back to the Quantum Bain definition, and he described it as an emotion that one feels towards another. He also proposed that attachment was a spatial phenomenon, where children exhibited specific behaviors in order to get near their caregivers, and he proposed that children would learn to identify familiar people versus unfamiliar people, and they had a built-in tendency to approach familiar people and avoid unfamiliar people. Finally, the feedback that children received from people when they interacted would affect the patterns of behaviors. That's a different definition than was used in the Ainsworth Strange Situation test. So, and it's different than requiring a secure base. So when you consider, and again, this is from the Crowell-Davis paper, Scott Fuller looked at puppies and found that by 10 weeks, they would maintain a relationship with familiar people and prefer to do that. They prefer to spend time with people than seek out food. And that's being replicated in other studies. And people have postulated that the dog-human bond may be different than the dog-dog bond, but we don't know the answer to that. So a number of studies have shown that dogs would rather be with people or have verbal instructions from people than have food, even if they know these people. So the question arises, does attachment affect behavioral pathology? And are dogs that are hyperattached having more behavioral difficulties than dogs that aren't hyperattached? So Partha-Sarathy and Crowell-Davis sought to test the idea that if separation anxiety was driven by the attachment in dogs, then dogs with separation anxiety would show different patterns of attachment behaviors than dogs without separation anxiety. Now, before we go any further, let's define separation anxiety and hyperattachment. Separation anxiety was defined in this paper as a behavioral pathology. So you'll exhibit physical, behavioral, and/or emotional distress only in the actual absence of the client or during a virtual absence where you don't have access to the client or the owner or your attachment figure. And for the dog, this has to be an intensive out-of-context alteration in autonomic reactivity, where their motor activity, their autonomic reactivity, heart rate, respiratory rate, vigilance and scanning are extreme, and they're exhibited to this level only in the virtual or actual absence of their person. Hyperattachment is not as crisply defined, but it's generally characterized as the dog's tendency to follow their owner and the need to always be in their presence. Signs cited as indicative of hyperattachment include excessive following, pre-departure cue anxiety, and excessive greeting behavior. And for some authors, hyperattachment's a requirement for SA. So, you know, there is at least one school of thought that says if you don't have hyperattachment, that is not separation anxiety. That's not the definition commonly used in North America. So the hypothesis from this paper was that dogs with separation anxiety would have different patterns of attachment-related behaviors than dogs without separation anxiety. And when alone, in a strange situation test modeled after the Ainsworth test, they'd spend less time investigating and more time close to their humans. When reunited with their owner, they'd spend more time in contact with them and they would be closer to them than dogs without separation anxiety. If the dogs were left loose in the house, when left alone, the dogs with separation anxiety would spend more time in proximity to the owner's exit door, whichever door they went out, that's where the dog would sit, than dogs without separation anxiety. And for dogs who are created in the home, there'd be a positive correlation between the durations and frequencies of the separation anxiety behaviors of these dogs when they were alone or at home, because they're in a crate, so they can't go sit by the door. So what did they find? Interestingly enough, dogs with separation anxiety spent no more time in contact with or proximity to their owners during the attachment test than did dogs without separation anxiety. Instead, they jumped on the door when strangers left the room and remained stationary when alone with their people. There was no difference between the two groups of dogs in the amount of time spent close to the exit doors when left home alone. Dogs crated at home showed no relationship between the amount of anxiety-related behaviors during the attachment test or at home. There was no significant difference in the proximity-seeking behaviors exhibited by dogs without or with separation anxiety at home, and this suggests that hyperattachment was not associated with separation anxiety. Okay, but it first showed up as being driven and driving separation anxiety in a set of recommendations published in 1999 in the Veterinary Record. And this is from Podbercheck et al. And I'm just I know this is small, I scanned it so you'd see the original. So I'll just read you some of the instructions. And you can see how theory and practice get a little knotted up here. And if you don't have data, how you can wander down the bad path. So they want you to stop punishing the dog, which is a good thing. Don't let the dog sit on the owner's lap or items of furniture when the owner's present. Owners should use a dog gate, a child gate, or a barrier to make dogs who slept, always a concern, previously slept in their or any bedroom, sleep outside the door, deny access to that location at all times. When it's deemed that the dog has accepted this, the dog can be accustomed to the door being closed, but they have to sleep in a different area. Don't give them gratuitous tidbits. Interaction only at the owner's initiative. All dog solicitation of interactions ignored. Owner's leaving procedures changed. No interactions unless they're urgent an hour before you leave. Dog is placed where it's normally left 20 to 30 minutes before the departure. And you can leave owner-scented clothes, chew items, tape recordings, whatever, but don't interact with the dog. And on returning home, remove your outdoor clothing as a signal and don't interact with the dog. And that's all because the logic in this paper is that you must break the attachment. So if you hear echoes of the need to dominate your dog in this advice, allowing them only to eat or play or eliminate on your schedule, and you have to start all the interactions, you're not wrong, it's here. So much old advice was affected by temporal cultural trends. I hope we view dogs differently now, but we're probably doing the same thing. And we have to realize this, which is why data are so important, because I think that that's an example of a strategy designed to depress most dogs. And it's very out of context to the way dogs have always lived with humans, and it's out of context to the way we now conceive dogs as part of the family. And that wasn't that long ago. So this is Jerry Flanagan's actual residency research paper. And he looked with Nick Dotman at hyperattachment in dogs. And they looked at dogs in a referral clinic population, in a specialty clinic at Tufts, and they looked at dogs with separation anxiety and those without, okay? And they looked at a number of issues. They looked at these groups in their referral population for the signs of separation anxiety, but they also looked at hyperattachment. Did they follow the owner? These are all the hyperattachment types of issues. And if you take a look at this, this is 200 dogs who did not have separation anxiety as a diagnosis, but had another behavioral diagnosis, and 199 who did have separation anxiety. 84% of the dogs with separation anxiety followed their people. 64% of the dogs who didn't have it followed them. So while this result is statistically significant, and I did the stats, and you can see the columns here, it's clear that hyperattachment is not necessary for this diagnosis. You had dogs that had separation anxiety that didn't follow, and the vast majority of dogs seen at that specialty veterinary hospital clinic at a university who had other problems followed their people also. So not good for hyperattachment so far. But what about shelter and rescue dogs? Well, this is a paper that's currently in press in our journal. And because it's in press, I really do want you to see what the authors say. And this is a paper by a chap by the name of Aaron Teixeira and Nathan Hall. It's a really lovely paper. And they investigated whether high arousal, excited departures and greetings with a dog led to an increased frequency of separation anxiety in newly adopted dogs. And they included, I use the word separation anxiety, they call it separation-related behavior because they include the whole suite of behaviors that may not be pathological. In the first experiment, now remember they're doing this because one of the pieces of conventional wisdom is that dogs who are rescued are overrepresented for separation anxiety. And while separation anxiety is common in dogs who are rescued, we don't actually have the data to say that they're overrepresented. And in fact, all of the studies have shown that dogs can come from any background and have separation anxiety. So they took two groups of these shelter dogs and exposed them to either high or low arousal human experimenter interactions. And they have wonderful pictures and schematic diagrams in their paper. Their hypothesis was that there would be an increase in activity vocalizations and time and proximity to the door, very similar to what Sharon Crowell-Davis hypothesized for the dogs in the high arousal condition compared to the low arousal condition when left alone. And that across 10 sessions, that should increase because if the hyperattachment stuff that Podberchek was talking about is correct, that becomes a learned and reinforced behavior. Our results did not show this. High arousal departures and arrivals may not play a role in the development of increased separation-related behavior. Okay. In experiment 2, they asked owners who had adopted their dogs and who had dogs with and without separation anxiety in a survey about their arousal levels during arrivals and departures at home. They hypothesized that dogs with separation anxiety would have been exposed to higher arousal levels during departures and arrivals. Their results showed a very small difference in the groups, and it was in the opposite direction that they had predicted. Dogs with reported canine separation anxiety were exposed to slightly lower arousal levels than dogs without separation anxiety. The difference was small and non-significant, and that may be historical because people have heard that you should greet dogs calmly. Okay. From both experiment 1 and 2, our results indicate that high excitement and playful levels of owners during departures and arrivals is not associated with the development of increased separation-related behavior in newly adopted dogs. There's a distinction and a caveat here, and this is just their abstract. Low arousal departures and arrivals are well-documented treatment for separation-related behavior, and they are only talking about a causal role, so that's a limitation. They repeat that limitation in their conclusions, and they note that neither this study nor any study to date has found that greetings, excited greetings and goodbyes leads to the development of separation anxiety. And in fact, they go on to say they find no evidence to support the role of arrival and departure activity as a causal factor when dogs are first adopted, because that's the constraints of their experiment. Okay, so you combine that with Sharon Crowell-Davis's study and Jerry Flanagan's study, and you've now got stuff that's just not adding up. Dogs can be distressed without being hyper-attached, and certainly these behaviors that Podvorchek sort of wanted you to stop don't seem to have anything to do with these behaviors. What about human behavior and attitudes? Now things become interesting. This is a series of papers from a group out of Budapest, and this is the 2019, the latter paper in the series, where there's an effect of an owner being less attached and less responsive to a dog. Dogs with owner-reported separation-related distress fit mainly into an insecure, anxious cluster. So we're back to the way dogs are characterized in attachment tests. Only here, their owners were not highly concerned about separation and suggesting a lower responsiveness and avoidant attachment style of the owner. So let's look at the way they clustered these data. So they ended up, if you take a look at the behavioral signs, the physiological signs, the greeting behavior, the dog's hypothesized attachment style, whether or not the owner worries, and the owner's hypothesized attachment. What you tend to find is that the behavioral signs are medium. Look at clusters 1 and 4. Physiological signs are low. That's remember I said the autonomic signs, you know, the heart rate, the panting, the GI signs, the autonomic hyperarousal. Greeting behavior is high, which is not unlike what Nathan Hall found. And in both cases, these dogs' attachment styles are secure. If the owner is very, very worried about the dog and how the dog behaves, doesn't matter how the dog is. If the dog's secure, it doesn't matter. The owner's hypothesized attachment is insecure and anxious. If the dog's secure and the owner's worries low, the owner's secure. Whether you're insecure and avoidant depends on these other signs. So this goes back to one of their earlier papers in 2015, where they looked at owners' influence of attachment style and their personality on the dog separation-related disorder. And in this case, they are truly talking about separation anxiety. Their results suggest that owners' attachment avoidance may facilitate the development of separation-related disorder and distress and anxiety in dogs, and they assume that avoidant owners are less responsive to dogs' needs and don't provide a secure base. And at that point, we're back to now, does the dog have a relationship with the owner? And their definition of a secure base is that relationship. Okay. And when they looked at the data, where they looked in Germany and Hungary at the separation-related distress score, and they looked at the extent of avoidance behaviors in both countries, the separation distress score increased with owner avoidance. And if you take a look at what happened with affection in Hungary, the separation-related distress score is absolutely flat. And neuroticism is a human personality trait where there's concern, and the more they expressed the anxiety associated with neuroticism, the higher the separation-related distress score, suggesting strongly that we may be looking at some of the wrong things. And if owners' response to their dogs is actually either engendering or facilitating or acting as a force multiplier here for uncertain dogs, that's something that we actually need to know. And this isn't about partitioning blame. This is about ensuring we understand the data of how dogs and humans interact so that we can protect the welfare of both groups and so that we can stop dogs from being distressed. So maybe we need to ask how dogs who have separation anxiety and dogs who don't are different when they're left alone. And this is a great paper by Clara Palestrini and colleagues. And they did a video analysis of dogs with separation-related behavior. And the analysis of the behaviors on tape showed that dogs spent most of their time vocalizing. It was 23%. and being oriented to the environment, looking around. They panted and they were passive, and some of them destroyed during the owner absence. Most dogs displayed signs within 10 minutes after the owner departure. Vocalization started within 3 minutes. Destruction started within about 7 minutes. Barking and orienting to the environment decreased over time, and time is truly 20 to 30 minutes. And panting increased over time. Panting's the autonomic sign. Panting's the sign of distress. This is the stuff about reacting to the departure. The panting is the sign of distress. The vocalizing is the social localization cue and the social affiliation cue. The panting is the behavioral pathology. And it continued while people were gone. That didn't happen with dogs. Same people, same group. And that didn't happen with dogs who didn't have separation anxiety. Those dogs just exhibited passive behaviors when the people left. So separation anxiety truly seems to be much more about distress than attachment, which means all that old nonsense about breaking the bond can sort of go away. Now, do we know anything about the putative causal effects of this distress? Well, we have one study that suggests that there may be, in some groups of dogs, a genetic link that may contribute, notice I'm not saying is causal, may contribute to the development of this condition. And this is the DRD2. This is a dopamine gene, and this is work out of Claire Wade's excellent canine geneticist Claire Wade's lab in Australia. And she looked at these two haplotypes, and if you get the cysteine haplotype, you have an enhanced risk in this group of golden retrievers in Australia. And I say that because all golden retrievers aren't the same, and it's even possible that all golden retrievers in Australia aren't the same. So we have clusters of codified genetic variation, and in this particular group, if you have one allele, you are at increased risk. If you have both alleles, notice the sample size 2, these dogs unambiguously had separation anxiety. These guys had some signs of distress. Important if true, and look at the sample size, needs to be explored. So we don't really have good mechanistic data. We have some indications that there may be some neuroendocrine and neurochemical causal implications, but I think we have to ask ourselves how we should treat these dogs. And we have to ask ourselves what punishment is for a dog because of this history of how we treat them. So these dogs are distressed, and they may not see the world the way we do, and they may have trouble assessing information. And if you're distressed and if you have trouble assessing information, what might be punishment? How would you view punishment if you were distressed, social, and had trouble assessing information? Well, all of the things that have been recommended, ignoring the dog when returning, ignoring when leaving, ignoring attention, breaking the attachment, this is punishment. Instead, we need to consider giving dogs accurate information, and somebody's actually looked at this. It's a really lovely paper by Chiara Meriti and her group at Pisa, and I've blown this up so that you can see it. Now, these are not dogs that have clinical separation anxiety. They're your basic dog. And they were left in a very controlled videotape study, and when dogs were petted before separation, they displayed behaviors indicative of calmness for a longer period of time, and their heart rate showed a marked decrease after the test. And this pilot study, it was a relatively small sample, so that they're legitimately treating it as pilot, suggests that petting a dog before a brief separation from the owner may have a positive effect, making the dog calmer. Okay, so does it happen? Well, this is my husband saying goodbye to Hamilton, and I just set this up to see what would happen. So you're going to see 2 videos. And you will see that my husband is not the world's best dog trainer. If you've met him, you already know that. And here's the first video where he's not going to pet Hamilton. He's not going to ask Hamilton to sit. He's not going to pet him. He's not going to address Hamilton. He's going to do some general thing like most of us do. Okay. And Hamilton does not wait, leaves. Okay. Here's the second video where he's going to ask him to sit, he's going to talk to him, and he's going to pet him. Watch Hamilton. And there he takes a deep breath and he's no longer panting. Okay. No practice. We just captured it. So that's what Chiara's talking about. So what about gradual departures and departure cues, which are all about them learning to be left alone? Boy, unless you're really good at behavior modification, be very careful about sensitizing the dog and rewarding some of the wrong stuff. So what I would really like people to do is I want them to remember that this is not about attachment. This is about distress. This is about behavioral pathology. They're a comorbid risk to separation anxiety. These dogs are overrepresented for all sorts of anxieties and hugely overrepresented for noise reactions. Meet the dog's needs. Behavior modification best focuses on teaching dogs to relax, self-calm, to attend to humans in the environment for cues that will be informative, just like Hamilton did, and take a deep breath and self-calm. And the rewards must include praise when the dog is spontaneously calm, which is absolutely a contraindication in the old way of doing things. So what we're doing here is, and this is the single most important piece of advice you could give anybody, what we're doing is we're telling the dog he or she is good when they're good, and we're providing accurate information. Okay. What about cats? Okay, so the first paper, the earliest paper on attachment in cats, isn't about cats or dogs, it's about humans. Okay, so skip that one. We tend to be so anthropocentric as humans that we need to start seeing things from the other side. This is a lovely paper out of Moises Heilblum's group, and Moises died quite young a couple of years ago. He was a very good friend of mine. He was on the editorial board of the journal, and he was really a very forward-thinking person who saw the world a little differently and very clearly, and very gentle soul who is much missed. But this is the first paper that was published on evaluating attachment in cats. And the members of his group looked at the individual behaviors. So they did all the same things that, you know, we've looked at in all of Sharon Crowell Davis's hypotheses. Locomotion and exploration, is the activity directed to objects or people, new people, unfamiliar people, vigilance, state of being alert, look at their body posture, inactivity, do they approach the door, physical contact with an owner, physical contact with a stranger, do they rub with their face or body against an object as a form of marking, do they vocalize, do they play, toys, people, any of that stuff. And what they ended up by finding out is that if you look at these data for the cats when they're with the owner versus alone versus with a stranger, there are significant differences for all of these categories compared to the owner versus the stranger in the direction, and many of them for being alone, in the direction that you would predict. In other words, they spend more time with their people than they do with strangers. They have a greater latency to approach a stranger. They vocalize a little bit more in the presence of strangers. They're inactive more in the presence of strangers. So they recognize somebody they know and somebody they don't know. And they stay with the person they know. And this is their version of the modified Ainsworth strange situation test, where the mother comes in and goes out as an attachment indicator. Well, here, the human goes in and out as an attachment indicator. So the cats follow the owner, made physical contact, jumped into the owner's lap, and that to them was evidence of an attachment. They didn't use the secure base effect. Okay. Then there was a paper that looked at the Ainsworth strange situation test in a randomized manner and showed no effect of familiar humans on attachment. Part of the problem is this is a test that's meant to be done in a certain order. And I think when you've got multiple test segments in 2 to 3 minute intervals and you randomize them, what you may be doing is distressing the cat. And one of the things that I think is really important to recognize is that cats don't do all that well in unfamiliar environments. And not all cats are socially outgoing. There are a number of cats who are much more shy and much more fearful and much more withdrawn. And in none of these studies does anybody discuss that. And when you do these types of randomized tests, I think that you might need to know how that type of change in the design might also affect the cat. So I'm not sure this isn't a spurious finding, especially since a very carefully done paper that was published fairly recently. This is in Current Biology. This is the only one of the papers I've cited. You won't be able to get it. It will not be released freely for a year after publication because it's a Cell journal and it's a very expensive journal. So what these people ended up by doing, this is a Vitali and Monica Udell study. This is a secure base test, okay, and that's their adaptation of the Ainsworth Strange situation test. Now, they are not making the distinction between the types of bonds and that the test and that the secure base buffers you in the way that Emanuela Prado-Provide made. So this is why I said, hold on to that difference. It's not defined the same way in this paper. They had 3 phases, 2 minutes with the caregiver, 2 minutes alone, 2 minutes reunion. It's an abbreviated form of this test. They tested 3 groups of cats, 70 kittens between 3 and 8 months of age who were tested once and then tested as they aged, 39 case control kittens, 31 controls. The cases went to kitten class, the controls didn't go to kitten class, and 38 cats greater than a year of age. And they found that cats with secure attachment cease any stress upon return, and they have contact with everybody in a balanced situation. Cats with insecure attachment would be expected to remain stressed upon return and or seek attention, and they would be ambivalent, and that's the most common of the cats. And cats that exhibit avoidant behavior have insecure attachment. That was a very small percentage of their cats. I want to say it was 4%. Some insecure cats have a disorganized or a mixed style. So their predictions matched what they found in these cats. And then they decided to check whether or not the differences in behavior were not simply due to stress responses, okay, which is exactly what I just commented on in the previous paper that found no attachment. And they used attachment theory predictions that secure and insecure ambivalent cats would show more distress at separation than insecure or avoidant cats. And sure enough, secure and insecure ambivalent cats showed equal amounts of vocalization when left, and they both showed more than the insecure avoidant cats. They know, in fact, that this is due to their attachment style as they've characterized it. And here are their data. So here's the secure cat who can come to you or not. Here's the ambivalent insecure cat who must be in your lap and must monitor the world from your lap. And here's the avoidant cat. There is a cat in that corner. And you see that the distribution in young kittens is pretty similar as they, so this is the kitten baseline and the kitten follow-up, and this is the adult group. So you've got a similar distribution across all age groups. In the ambivalent group, you have more kittens in this ambivalent group, and by the time you get to the avoidant group, you have more adults. Okay. So we know that cats do these attachment things, but they do them in ways meaningful to cats, and they don't do them in the same way that dogs do. And dogs do them in meaningful ways to dogs. And that means that maybe we should consider that cats could have separation anxiety, which is something that Stephanie Schwartz, who's a specialist, has considered for a long time. And here are her data. 96 out of 136 cats with separation anxiety had inappropriate urination. Oftentimes, it's not that they hate the litter box, it's that you're gone and they eliminate when you're gone. Of these cats, 72 or 75% of them urinated only on the owner's bed. So it's something about the owner. 48 cats had inappropriate defecation. I've left out a word, but it's down here. 16 cats had excessive vocalization. 12 cats exhibited destructiveness, and a few plucked out their hair. And here are the data. So what we have here are cats that do these behaviors only when they're left alone. And the real problem here is that we have concerns about what we don't know and why we need to change our way of knowing anything. The problem with comparing standard signs of separation anxiety in cats and dogs is that the species are different evolutionarily, and we live with them differently. How many people who have cats that are trained to litter boxes know whether they eliminate differently when they're home and when they're not home? You take dogs out. You move with them differently. You walk with them differently. Vocalizations differ. That's an evolutionary difference. It's a breed difference. We miss subtle signs of separation anxiety in dogs. We miss the panting, the salivating, the trembling. How likely are we to appreciate these in cats when a normal response to stress in a cat is to hide? And there is a real need to establish a baseline of normal behaviors, including times for adaptation and before you can be certain of a behavioral transition, and that you're not measuring stress, for ways that evaluate species responses in ways that's meaningful to that species. And that's where I want to see this field go. We've got an idea of what we don't know now. We need to go and collect those data because we need to serve the animals we live with. Regardless of this, if you're a veterinarian and you're listening to this, please screen every single patient at every single visit for signs of distress when left alone and in other situations where they may experience distress. If you're not a veterinarian and you have a dog or a cat, ask your veterinarian to screen your dog or your cat, or you do it. I can send you forms. They're available freely on my website. Treat early and aggressively. Use interventions for which efficacy is established. And I'm going to harp on medication, and we'll talk about it during the next webinar, and behavior modification based on learning principles that is humane and kind and meets animals' needs. Because if we do that, we can provide care, comfort, and sanity, and do so with the guidance of an increasingly large database. So these are my guys, who I do think are fairly attached. Annie is now 8 months of age, wrapped around Hamilton. My email address, koverall@upei.ca. The journal, if you're interested in subscribing or looking at it. I do tweet occasionally about animal issues. I've stayed away from international politics, which is sort of amazing. And there are a number of handouts and other things, papers, videos, freely available on my website. And again, I'd like to thank the Sir James Dunn Animal Welfare Center for facilitating this webinar and creating this series. It's been great over the past few years. So if there are questions, and I didn't even look to see if there were questions in the chat, Katie.
That's okay, we can take them now. So if anyone has any questions, go ahead and put it in the Q&A box. And while we're waiting, you can also put it in the chat box because we can see that as well.
Well, I feel good that there are no open questions, given that I think everybody knows I tune these out.
They were too busy listening to what you had to say.
I'll let you look at the dogs some more.
So I'll ask a question while we wait for people to type in their questions. I I guess one question that's more specific to cats. So we've heard a lot about treating dogs with separation anxiety, but we don't really talk as much about treating cats with separation anxiety. So are there any differences between the two? We know they're different animals. Or do we know, I guess, yet of different recommendations for cats?
There really are. And this is a case where drugs are your friend. And I know that sounds strange, but cats either manage stress by withdrawing from it and observing it and then making decisions about their social environment. But almost every behavioral condition you see in cats, if you explore that history well, you will find out there's been a disruptor from that cat's perspective to their social environment. Cats are not fully domesticated in the same sense dogs are. Dogs have lived with us for half of the 60,000 years we've been humans. So you don't tend to get the same type of innate pathology that seems like it's atypical for the species in cats that you do with dogs. In cats, you're getting a feline response. And if the only way to alleviate that neurochemical evidence of distress is medication, we need to consider it. However, very often, if you can identify the social stressor, cats do extremely well. Clients are not often very good about doing behavior mod with cats, partly because the cats don't often care. Some of them do, some of them don't. It very much depends on the cat. And it requires somebody to be very observant of cats. That said, if you don't have one of those deeply fearful cats and you are observant, you can teach cats to do absolutely everything you can teach dogs to do. And in these cases, these cats may just need someone to be with them, or they may need someone to be with them virtually, which in the day and age of Zoom, in the day and age of Furbo, may in fact be quite possible. So it is very different in dogs and cats, and how we treat cats is underexplored compared to dogs. If they're truly, truly distressed, and our problem is always, you know, you can only urinate on an owner's bed so often before most owners are deciding that maybe you need to live elsewhere. So if you're reaching that point, you know, I know a lot of people don't like the idea of medication, but if what it does is it relieves suffering and allows cats to learn a different way of dealing with that, and it's worth it. Would you start a dog on separation anxiety with separation anxiety and fluoxetine at 0.5 milligrams per kilo or 1 to 2 mgs per kilo? And what if the dog, I think that's supposed to be what if the dog has poor appetite due to the anxiety, would you start on clomicron instead? And would you use alprazolam as well too, or add in later? This person's obviously a veterinarian. Okay. This is an interesting question. And the way I tell people to make decisions between the SSRIs and clomicon, which is TCA, is if the dog, clomipramine, clomicon, was actually developed for ritualistic behaviors, and it works brilliantly for ritualistic behaviors. So one of the things that you need to consider is how repetitive are these behaviors. If you think the behavior is more repetitive than explosive, and fluoxetine was developed for explosive anxiety disorders, choose clomipramine. If you think it's more explosive and the dog just erupts in its distress, choose fluoxetine. Now, there are another half dozen SSRIs in there that the dog may also respond to. If you've got a dog who is already fussy about food, fluoxetine and some of the other SSRIs, citalopram, sometimes even sertraline, you may have to rattle through all of them before you find one that doesn't affect the dog's appetite, because really you want the dog on a behavior modification program, so he needs to be able to have food, he needs to eat his food treats, He needs to learn that if he interacts with a food toy, maybe that's a little helpful. It won't fix his separation anxiety, but you know that if they couldn't use their food toy before and now you come home and they have used their food toy, obviously they're getting better. They can eat. They can physiologically eat. So you want them to be able to eat as normally as possible. Fluoxetine has as one of its uncommon but not completely rare adverse events that dogs can become anorectic. And what I tell people is if they stop eating, don't try to bait them because they stop. And if they don't eat for a day, you're not going to get them over it. Change the drugs. Question here was a dosage question also. There is a debate in the literature about the dosage of fluoxetine. I start at up to 0.5 milligram per kilogram. And why do I do that? Because I end up often seeing dogs that other veterinarians and other specialists have seen. And by the time they walk in, they're on 2 to 4 milligrams per kilo of fluoxetine. And the dogs, while they don't have serotonin syndrome, people forget that serotonergic drugs are activating. And they're dumping serotonin and they're jittery and their heart rate is up. And do you think that's making your anxiety worse or better? It's making it worse because those are the signs of anxiety, and serotonin can be anxiogenic at some levels, okay? It's not the serotonin that's fixing the anxiety. It's the fact that it kicks in a second messenger system that allows you to translate protein and make better connections in the regions of the brain where the serotonin is the neurotransmitter that allow you to process higher order associations. So I tend to start low. The journal published a paper last year out of Cornell that showed in a retrospective study that with fluoxetine, lower dosages were better. So if you're at 0.5 milligram per kilo or 0.5 mg to 1 mg per kilo, those dogs did better than 1 mg and up. So that's how I start. Do I have the occasional dog on a high dose? Of course. They're pretty rare in my population. Do I have the occasional dog on a high dose of clomipramine? Of course. Again, they're pretty rare. There are cytochrome P450 enzyme system variants that very likely make some dogs ultra-fast metabolizers. We lack data on this, but it happens in every other species that's being looked at. And if that's true, well, then some animals need higher dosages. Vast majority of us won't. What's the washout period when switching between SSRIs? Depends on the SSRI. If you're going from, citalopram or escitalopram to anything, you don't have to wash out at all. Very short half-life things, you can go right away. If you're on a low dose of a TCA and you want to switch to an SSRI, it's going to do slightly different things. Chances are you can just switch. If you're worried because there are cardiac effects or the client is worried, the standard washout period is considered to be 10 to 14 days. You can also decrease one while increasing the other. The exception to all of this is fluoxetine. Fluoxetine hangs around in an assortment of altered drugs that it becomes that are active for a very, very, very long period of time. You can still detect it in most humans and dogs a month and a half after you've given the last pill. So it's the only one of these drugs you can actually stop abruptly and safely, but it also means that if you've been on a high dose of fluoxetine, you lower the dose for 2 weeks, you lower the dose again for 2 weeks, you go to every other day. And when you're going to every other day, you can start with a very low dose of your other medication and wean up. Can you be a cowboy and sort of smack them all together in an emergency, like someone's going to kill the dog? Yes, I've done it. But you've got to have people who can watch like a hawk. And I wouldn't do it if the dog was on a high dose, because my sense of that is I have never, now it's a skewed sample, you need to know that. These are dogs coming to me that I'm taking off the drugs they're on, but I've never seen a dog walk in to see me that is on a high dose of fluoxetine who doesn't have signs of autonomic hyperreactivity due to the serotonergic effect.